What if the struggles you're facing with energy, vitality, and intimacy aren't actually about your age, but about 7 specific mistakes that are quietly robbing you of the life you deserve? I'm Dr. Jessica Williams, and in my 12 years as a urologist specializing in men's health, I've discovered something that transformed how I help my patients. The decline that so many men accept as normal aging is often not normal at all. It's preventable. Most men think that after 60, losing vitality is inevitable, that struggling with energy, motivation, and intimate connection is just what happens, that you need to lower your expectations and accept a diminished version of yourself. But that's a lie. And believing it has cost thousands of men the best years of their lives. The truth is this: when you stop making these 7 specific mistakes, your body can reclaim vitality, energy, and intimate function that you thought were gone forever. Before we dive in, please hit that like button right now. Drop a comment telling me where you're watching from and subscribe to this channel. What I'm about to share could genuinely change the trajectory of your life. Let me tell you about a patient whose story will probably sound familiar. His name was Kenneth, 71 years old, retired engineer, married for 45 years to the love of his life. But when he walked into my office, he looked like he'd given up on something fundamental. "Dr. Jessica Williams," he said, his voice heavy with resignation, "I don't feel like myself anymore. I wake up tired. I have no drive for anything. My wife and I, we've become more like roommates than partners. And physically, things that used to work just don't." He looked at me with eyes that had lost their spark. "Everyone tells me this is just aging, that I need to accept it, but it feels like I'm disappearing and I don't know how to stop it." I've had this conversation hundreds of times. Men who've been told that their declining vitality is inevitable, that there's nothing to be done except accept a smaller, dimmer version of life. But here's the truth that changes everything. The decline in vitality, energy, and intimate function that happens to so many men after 60 is not primarily about age. It's about specific correctable mistakes that compound over time. Your body at 70 is different than it was at 30. That's biology. But the degree of decline you experience is largely determined by 7 critical mistakes that most men make without even realizing it. When I examined Kenneth comprehensively of looking at his hormones, his lifestyle, his daily habits, his medications, his sleep patterns, his stress levels, I found he was making 6 of the 7 mistakes I'm about to share with you, and every single one of them was stealing his vitality. Here's what most men don't understand. Your body wants to function well. It wants energy, vitality, strength, and intimate capability. But when you make these 7 mistakes, you're actively working against your body's natural design. It's like trying to drive a car with the parking brake on. The engine is fine. The problem is that you're creating resistance that prevents it from functioning properly. When I helped Kenneth identify and correct these 7 mistakes systematically over the course of 6 months, something remarkable happened. His energy returned. His mental clarity improved. His relationship with his wife transformed as intimacy and connection returned to levels they hadn't experienced in over a decade. "Dr. Narita," he told me during a follow-up visit, tears in his eyes. "I thought the man I used to be was gone forever. I'd grieved for him, but he wasn't dead. He was just buried under mistakes I didn't know I was making. This isn't about returning to your 25-year-old self. It's about being the best, most vital version of your current age. And that's absolutely possible when you stop making these 7 critical mistakes." Before we go through the 7 mistakes, let me explain why this matters so profoundly for men over 60. The 3 pillars of male vitality. Vitality, energy, and intimate function all depend on 3 interconnected systems working properly. Number 1, hormonal balance. Primarily testosterone, but also thyroid, cortisol, and insulin. These hormones regulate energy, motivation, physical function, muscle mass, fat distribution, and intimate capability. Number 2, vascular health. Your cardiovascular system must deliver blood efficiently throughout your body. This affects energy, physical stamina, cognitive function, and intimate response. Number 3, nervous system function. Your brain and nerves must communicate clearly with your body. This system is profoundly affected by stress, sleep quality, inflammation, and psychological state. Why? These systems become vulnerable after 60. As you age, natural testosterone production declines about 1 to 2% per year after 30. Blood vessel flexibility decreases. Cellular energy production becomes less efficient. Recovery from stress takes longer. Sleep architecture changes. Chronic inflammation tends to increase. But here's the critical insight. The rate of this decline is heavily influenced by the 7 mistakes we're about to discuss. 2 men can both be 70 years old. One is vital, energetic, and maintains an intimate connection with his partner. The other is exhausted, disconnected, resigned to decline. The difference usually isn't genetics or luck, it's whether they're making these 7 mistakes. The mistakes I'm about to share interfere with one or more of these 3 critical systems. And because they're often invisible or normalized, men don't realize they're causing their own decline. But that also means when you correct these mistakes, your body can recover the function you thought was permanently lost. Let's go through each mistake carefully and honestly. Pay attention because you're almost certainly making at least 3 of these right now. Mistake number 7, accepting low normal hormone levels as acceptable. The first mistake is accepting hormone levels that are technically within normal range but are actually far too low for you to feel vital. The biological impact. When you get lab work, your doctor might say your testosterone is normal, but here's what they often don't explain. Normal ranges are extremely broad. A testosterone level of 300 nanogs per deciliter is considered normal for your age. So is 900 nanogs per deciliter. But the difference between those 2 numbers is the difference between feeling exhausted and depleted versus feeling energetic and capable. Most men over 60 are told their levels are normal for your age when they're actually in the bottom 20% of the reference range. At these low normal levels, energy is chronically low. Muscle mass decreases. Body fat increases, especially around the midsection. Mental clarity diminishes. Motivation declines. Intimate drive and function suffer. Overall sense of vitality disappears. The emotional impact. When your hormones are suboptimal, everything feels harder. You lose motivation. Things that used to excite you feel like obligations. You become a shadow of who you were. The fix: get comprehensive hormone testing, total testosterone, free testosterone, the active form, estrogen. Yes, men need this measured too. SHBG, sex hormone binding globulin, thyroid panel, TSH, free T3, free T4, cortisol, vitamin D, complete metabolic panel. Work with a doctor who understands hormone optimization, not just normal ranges. If your levels are suboptimal, explore lifestyle optimization, sleep, exercise, stress management, nutrition, targeted supplementation, hormone replacement therapy if appropriate. Kenneth's testosterone was 310 nanogs per deciliter. Technically normal, but far too low to feel vital. Once optimized to 650 nanogs per deciliter through lifestyle changes and medical support, his energy, strength, mood, and intimate function all transformed. Don't accept normal for your age as good enough. You deserve optimal function. Mistake number 6, living in a constant state of chronic inflammation. The second mistake is allowing chronic low-grade inflammation to persist throughout your body. The biological impact. Inflammation is your body's response to injury or threat. But when it becomes chronic and systemic, it destroys vitality in multiple ways. Hormone disruption. Chronic inflammation interferes with testosterone production and increases its conversion to estrogen. Vascular damage. Inflammation damages blood vessel linings, reducing circulation and contributing to cardiovascular disease. Energy depletion. Your immune system constantly fighting inflammation drains energy that could be used for vitality and function. Cognitive decline. Inflammation in the brain impairs memory, focus, and mental clarity. Physical decline. Inflammation accelerates muscle loss and contributes to joint pain and stiffness. Common sources of chronic inflammation. Poor diet. processed foods, sugar, unhealthy fats, excess body fat, especially visceral fat around organs, chronic stress, poor sleep, lack of physical activity, unresolved infections or health conditions, environmental toxins, the emotional impact. Chronic inflammation makes you feel perpetually off. Not sick exactly, but never fully well, always tired, achy, foggy, and diminished. The fix. Adopt an anti-inflammatory lifestyle diet. Eliminate or drastically reduce processed foods, sugar, and fried foods. Eat fatty fish, salmon, mackerel, sardines 2 to 3 times weekly. Load up on colorful vegetables and berries. Use olive oil and avocado oil. Include nuts, seeds, and legumes. Consider turmeric, ginger, and green tea. Movement. Regular exercise reduces inflammation significantly. Even walking 30 minutes daily makes a dramatic difference. Sleep. 7 to 8 hours of quality sleep is profoundly anti-inflammatory. Stress management. Chronic stress drives inflammation. Daily stress reduction practices are essential. Body composition. Losing excess body fat reduces inflammatory markers dramatically. Supplements to consider omega-3 fatty acids, curcumin, vitamin D, magnesium. When you reduce chronic inflammation, everything improves. Energy, mental clarity, physical function, and intimate health. Mistake number 5, neglecting strength and muscle mass. The third mistake is allowing muscle loss to continue unchecked. After 30, men lose about 3 to 5% of muscle mass per decade. By 60, many men have lost significant strength and muscle, and they accept it as inevitable. The biological impact, muscle loss sarcopenia, is devastating for vitality. Metabolic impact. Muscle is metabolically active tissue. Less muscle means lower metabolism, easier fat gain, worse blood sugar control, and reduced hormone production. Hormonal impact. Strength training is one of the most powerful natural testosterone boosters. When you stop building muscle, testosterone declines faster. Functional impact. Muscle loss means reduced physical capability and independence, increased risk of falls and injury, lower energy levels, reduced confidence, vascular impact. Muscle helps pump blood back to your heart. Less muscle means less efficient circulation. The emotional impact. Watching your body become weaker and less capable creates a profound sense of loss and aging that affects confidence, mood, and vitality. The fix. Prioritize strength training, resistance training 2 to 3 times per week. You don't need a gym, though it helps. Bodyweight exercises, resistance bands, or free weights all work. Focus on major muscle groups: legs, back, chest, shoulders. Progressive overload. Gradually increase difficulty over time. Adequate protein, 0.7 to 1.0 grams per pound of body weight. Spread throughout the day, especially important around workouts, recovery, rest days between sessions, adequate sleep, good nutrition. Kenneth had lost over 20 pounds of muscle in his 60s. When he started a simple strength routine twice weekly and increased his protein intake, he gained back 12 pounds of muscle over 8 months. His energy, confidence, and physical capability improved dramatically. You don't need to become a bodybuilder, but maintaining muscle mass is essential for vitality at any age. Mistake number 4, prioritizing everything except sleep. The fourth mistake is treating sleep as optional or unimportant. The biological impact. Sleep is when your body produces the majority of its testosterone during deep REM cycles, repairs tissues and builds muscle, consolidates memories, clears metabolic waste from the brain, regulates hormones, reduces inflammation. When you chronically get less than 7 hours or have poor sleep quality, testosterone production drops by 10 to 30%. Cortisol stress hormone stays elevated, insulin sensitivity worsens, inflammation increases, cognitive function declines, energy is depleted. Research shows that 1 week of sleeping 5 hours per night can reduce testosterone levels by 15% in healthy young men. In older men, the effect is even more pronounced. The emotional impact. Poor sleep creates irritability, brain fog, loss of motivation, and a general sense of struggling through life rather than living it fully. The fix: make sleep non-negotiable, sleep hygiene. Consistent bed and wake times, even weekends, 7 to 8 hours in bed nightly. Cool room 65 to 67 degree F. Completely dark blackout curtains, eye mask, quiet white noise if needed, comfortable mattress and pillows, evening routine, no screens 60 to 90 minutes before bed, no caffeine after 2 p.m., no alcohol 3 to 4 hours before bed, light dinner, not heavy meal, relaxing activity, reading, gentle stretching, meditation, address sleep disorders, get evaluated for sleep apnea if you snore, gasp, or wake frequently. Sleep apnea is epidemic in older men and devastates testosterone and vitality. CPAP treatment can increase testosterone by 100 plus nanogs per deciliter. Kenneth had undiagnosed sleep apnea. Once treated, his testosterone levels increased dramatically, and he felt more rested than he had in a decade. Mistake number 3, eating in ways that destroy vitality. The fifth mistake is eating a diet that works against your hormones, circulation, and energy. The biological impact. Certain eating patterns are particularly destructive for vitality. High sugar and refined carbs spike blood sugar and insulin. Insulin suppresses testosterone production, creates energy crashes, promotes fat gain, damages blood vessels. Processed foods, full of inflammatory compounds, disrupt hormone balance, damage gut health, provide empty calories without nutrition, inadequate healthy fats. Testosterone is made from cholesterol. Without adequate healthy fats, hormone production suffers. Insufficient protein leads to muscle loss, reduces satiety, impairs recovery. Excess alcohol directly suppresses testosterone, disrupts sleep, damages liver, which processes hormones. The fix: eat to support vitality. Prioritize plenty of vegetables, especially leafy greens. Quality protein at each meal. Healthy fats, olive oil, avocado, nuts, fatty fish, whole food carbs, not processed. Adequate hydration. Minimize sugar and refined carbs, processed foods, fried foods. Excessive alcohol limit to 3 to 4 drinks per week. Specific foods that support male vitality. Eggs rich in healthy fats and cholesterol for hormone production. Fatty fish omega-3s for inflammation and circulation. Oyster zinc for testosterone. Pomegranate improves circulation. Dark leafy greens, nitric oxide for blood flow. Beets circulation support. Dark chocolate vascular health. You don't have to be perfect, but making your diet 80% supportive makes a dramatic difference. Mistake number 2, treating stress as just part of life. The sixth mistake is accepting chronic, unmanaged stress as normal. The biological impact. Chronic stress is one of the most destructive forces for male vitality. Hormonal devastation. Cortisol stays constantly elevated. High cortisol directly suppresses testosterone production. Your body prioritizes survival over vitality when stressed. Vascular damage. Chronic stress damages blood vessels, increases blood pressure, reduces circulation, nervous system dysfunction, keeps you in fight or flight mode, prevents relaxation necessary for intimate function, impairs sleep quality, mental and emotional impact, creates anxiety and depression, reduces motivation and drive, impairs cognitive function, damages relationships, the emotional impact. Chronic stress makes you feel like you're constantly treading water, never able to fully rest, enjoy life, or connect meaningfully with others. The fix: implement consistent stress management, daily practices, 10 to 20 minutes of meditation or deep breathing, regular exercise, powerful stress reducer, time in nature, meaningful social connection, activities you genuinely enjoy, boundary setting. Learn to say no. Protect your time and energy. Reduce obligations that don't serve you. Professional support, therapy or counseling, couples therapy for relationship stress, medical evaluation for anxiety or depression, mindset shifts, practice gratitude, focus on what you can control, let go of perfectionism, prioritize presence over productivity. Stress management often improves vitality as much as any medical intervention. Mistake number 1, suffering in isolation without seeking help. And here's the most damaging mistake of all: suffering alone and not seeking proper medical evaluation and support. The biological impact. When you don't get proper evaluation and treatment, underlying medical conditions go undiagnosed, hormone imbalances persist, medication side effects go unrest, treatable problems become chronic, small issues become major problems. Many conditions that affect vitality are completely treatable. Hormone deficiencies, sleep apnea, cardiovascular disease, diabetes or prediabetes, thyroid dysfunction, depression or anxiety, medication side effects. But if you never seek help, they never get addressed. The emotional impact. Suffering in silence creates shame and embarrassment, isolation and loneliness, relationship distance, loss of hope, acceptance of unnecessary decline. The psychological toll of believing you're alone in your struggle often causes more suffering than the physical problems themselves. The fix. Break the silence in 3 directions. Number 1, with medical professionals. Schedule comprehensive evaluation, physical exam, complete hormone panel, cardiovascular assessment, sleep evaluation, medication review, mental health screening. Work with doctors who take your concerns seriously. Look for optimization, not just normal ranges. Consider the whole person, not just individual symptoms. Are willing to explore all treatment options. Number 2, with your partner. Have honest conversations. Share what you're experiencing. Explain it's not about them or your attraction. Discuss how you're addressing it. Ask about their experience. Work together on solutions. Communication creates connection, reduces anxiety, and often improves outcomes dramatically. Number 3, with trusted others. You'd be surprised how many men are experiencing similar challenges. Breaking the isolation by talking with trusted friends can provide support, reduce shame, and share resources. Kenneth told me the hardest thing was admitting he needed help. But once he did, and once he had comprehensive evaluation and treatment, everything changed. I spent 5 years thinking I just had to accept decline. He said, if I'd known that help was available, I would have sought it years earlier. I want to pause and speak directly to something you might be feeling right now. If you're experiencing declining vitality, energy, and intimacy, I know this touches something deep. Your sense of masculinity, your identity, your purpose, the way you connect with your partner, how you see yourself. And I need you to hear this. Experiencing these challenges does not make you less of a man. It makes you human. The overwhelming majority of men over 60 experience some level of these changes. You are not alone. You are not broken. You are not failing. But you also don't have to accept profound decline as inevitable. The 7 mistakes we've discussed are all correctable, every single one of them. And when you correct them systematically, your body can reclaim vitality that you thought was permanently lost. I also want you to know this isn't about becoming 25 again. That's not realistic, and it's not the goal. The goal is being the most vital, energetic, capable version of your current age. And that's absolutely achievable. Vitality in your 60s, 70s, and beyond looks different than it did in your 30s. But different doesn't mean lesser. It can still be deeply satisfying, meaningful, and full of life. Be patient with yourself. These mistakes took years to create their effects. They'll take time to reverse. Most men notice meaningful improvements within 8 to 12 weeks of addressing these mistakes, but the full transformation often takes 6 to 12 months. That might seem like a long time, but consider this. A year from now, you'll be a year older regardless. The only question is whether you'll be a year older and more vital or a year older and more declined. The choice is yours. Kenneth told me 1 year into his journey, I spent my entire 60s accepting decline. I thought that's just what happened. Now I'm 72 and I feel better than I did at 65. I just wish I'd known sooner. Now the question is, what will you do with that knowledge? So here's exactly what I want you to do starting today. First, review the 7 aging mistakes, accepting low normal hormones as acceptable, living in chronic inflammation, neglecting strength and muscle mass, treating sleep as optional, eating in ways that destroy vitality, accepting chronic stress, suffering in isolation without seeking help. Second, honestly identify which ones you're making. Most men are making 3 to 5 of these right now. Third, pick 2 to address immediately. Maybe it's scheduling comprehensive hormone testing and starting a strength training routine, or prioritizing sleep quality and adopting an anti-inflammatory diet. Fourth, commit to addressing those 2 mistakes for 60 days. Give your body time to respond. Fifth, after 60 days, assess your progress and add another mistake to address. Build momentum progressively. Sixth, schedule an appointment with a men's health specialist or urologist for comprehensive evaluation. These lifestyle changes work best alongside proper medical care. And finally, if this video provided valuable information that could change your life or the life of someone you care about, please do 3 things. Hit that like button. It helps this content reach other men who desperately need it. Subscribe to this channel for more evidence-based men's health guidance. Drop a comment below. Tell me which of these 7 mistakes hit home the hardest for you. I read every comment, and your engagement helps me create content that truly serves you. Here's what I know after 12 years of helping men reclaim their vitality. Age is inevitable. Decline is optional. The difference between men who age miserably and men who age vibrantly usually comes down to these 7 mistakes. You can be 65, 70, 75, 80 years old and still feel vital, energetic, strong, and capable. Still maintain intimate connection with your partner. Still wake up excited about your day. It won't look exactly like it did at 30, but it can still be deeply satisfying and full of life. What matters is refusing to accept unnecessary decline, refusing to make the 7 mistakes that rob so many men of their best years. Kenneth thought his vital years were behind him at 71. He'd accepted a diminished version of life as his new reality, but he was wrong. He wasn't too old. He wasn't beyond help. He just needed someone to show him which mistakes were stealing his vitality. Once he knew, he could change and everything transformed. That can be you. Your chronological age is just a number. Your biological age, how your body actually functions, is determined by the choices you make every single day. Stop making these 7 mistakes. Start supporting your body's natural design. And watch as vitality you thought was gone forever begins to return. You deserve to feel strong, energetic, and alive at any age. And it's possible starting today. Thank you for trusting me with something this important. Thank you for believing you're worth the effort. Thank you for refusing to accept unnecessary decline. I'm Dr. Jessica Williams, and I'll see you in the next video. Now go make choices today that honor the vital, capable man you truly